I'm the Chief Medical Officer of the Secours Heart and Vascular Institute in Virginia. I found double actually just surfing the web a couple of years ago and thought that it could have some potentially really helpful applications for my practice. I keep it mainly in the cardiac surgery intensive care unit and use it mostly to round when I'm not here. Before double, I would call the ICU in the evenings sometimes, especially if there was a patient that I was concerned about, and it would just be a phone call between the nurse and myself. Since I've gotten double, I have that extra dimension of not just speaking to the nurse, but being able actually to look at the patient, look at the monitor, and just get an intuitive sense of how things are. There's been data that showed that the more the patients are seen, especially in the evenings for the night shifts, that the better long-term outcomes there are. So it's a real enhancement. It's another aid to giving better care. The mobility, I think, is the single best feature, and how really easy it is to drive all around. And I've done that from distances. Been away to a meeting on the West Coast and then been able to check in or go from the intensive care unit to the step-down unit to check in with a family member who I hadn't gotten to speak to, for example. And you do have a real connected conversation, which is different from a phone call. It's definitely a much more personal interaction when you can look eye to eye. It's nice to be able to just do it from any modality. I've done it from an iPad, I've done it from an iPhone. So to be able to just do that from almost anywhere at any time without having to wait to go through the unit secretary and then for her to find the nurse and whatnot, it's great. So I typically arrive at the hospital at 6:30 in the morning, occasionally earlier, and rarely leave before 7 or 8 at night. By knowing that I could check in at 9, 10, 11, 12 o'clock or before I decide it's time to go to sleep, it does give me some peace of mind, allows me sometimes to leave a little earlier than I might have otherwise. It's a great investment, especially when you consider that there are robotics systems used in medicine in the market that cost 10, 20 times more than what this system cost. The return on investment is huge. It didn't take a lot to convince the hospital administration that this was a simple thing to buy and that it had significant patient benefits.